Thank you for staying up with us tonight for First Coast News at 11. I'm Anthony Austin.
I'm Heather Crawford, and we start tonight with a warning for parents and for kids and for anyone thinking about taking a pill that you did not get from your pharmacy. The DEA is seeing a huge spike right now in fake versions of prescription medicine, of commonly used painkillers, things like oxycodone, Xanax, and Adderall. They are being laced with fentanyl and meth for one reason: to get you addicted. And tonight, a St. Johns County father is talking about just how deadly fentanyl can be.
It is available right now in the Jacksonville area, across the state of Florida.
I found my son on September the 30th, and I hope no parent ever has to go through that.
Steve Betts lost his oldest son, Tony, to an overdose last year. Tony was just 32 and the father of a little boy.
It took a long time to read the death certificate, but it was fentanyl.
He says his son started with pills and battled addiction for years.
I'm very proud of Tony for how hard he fought, because he didn't want to live that way.
Tony is one of nearly 100,000 people who died of an overdose in the United States between last March and this March, according to the CDC. During the first half of 2020, deaths caused by fentanyl in Florida increased by 81%, making it the most dangerous drug in the state, according to Project Opioid. For the first time in 6 years, the DEA has issued a public safety alert to warn about an alarming trend that could cause even more overdoses. The cartels are now lacing counterfeit pills with fentanyl and meth to make them more addictive.
And they're so readily available because Americans can just get online. It's right at their fingertips. They can get it through social media. They can get it through e-commerce.
Laverne Hibbert, acting special agent in charge of the Miami Field Division of the DEA, says the number of counterfeit pills her agency sees laced with fentanyl has jumped nearly 430% since 2019. Look at these pills. Can you tell which one is fake?
There are no red flags. It looks identical.
The DEA says China is supplying chemicals for the manufacturing of fentanyl in Mexico.
They are mass producing millions of counterfeit pills.
Think about the tip of a pencil. That small amount of fentanyl can kill you. Hibbert says 2 out of every 5 pills with fentanyl contain a potentially deadly dose.
1 pill will kill. That is the message. Don't take anyone else's prescription.
We're just in a real emergency situation. We have people that have never used a drug before that might just be out of their prescription and find a pill, or they obtain it some way and they end up dying, or they end up seriously sick.
Dr. Lanty Jordanby, Chief Medical Officer at Lakeview Health, is an addiction psychiatrist.
With this new fentanyl that's out there, it is not your prescription fentanyl. It's what we call an analog, or a chemical version of fentanyl, and it is sometimes 100, 1,000 times more potent than what people are used to with a prescription.
Children and adults are being targeted without even leaving their home, as the DEA says drug dealers are hiding in plain sight on social media.
You experiment one time now as a teenager or one time as a kid, it could kill you.
For the drug cartels, it comes down to profit. The more people who are hooked, the more money they make.
They're capitalizing on Americans who may not be able to afford certain legitimate prescriptions.
If Tony would have known when he was young that that first pill was going to lead to the 12 years and then the end, he would have never done it.
Tony's father and stepmother hope by sharing his story, it will spare another family from going through the pain they've endured.
I want people to know it is everywhere, and it doesn't discriminate. It's in every neighborhood, rich or poor, white or black.
Steve hopes you will talk to your kids about the dangers and remember his son Tony.
Life was worth more. Let's learn from it. Let's save that one more life. Let's get those dealers off the street, and let's stop any other family from having to go through the pain that we've been through.
And we are talking about drugs, not drugs that you get at the pharmacy, but ones that you are finding online and on the street. And Tony's dad is taking part now in Project Opioid. It's a coalition that is bringing together business, faith, government, and philanthropic leaders with one goal: to reduce opioid deaths. If you want to get involved, I've posted a link in this story on firstcoastnews.com. And if you or someone you love is battling addiction, it's important to know that help is available. Pick up the phone right now and call 1-800-662-HELP. Addiction is a treatable disease.